10 Ways to Control High Blood Pressure Without Medication. If you've been diagnosed with high blood pressure, you may also have a concern about taking medication to lower it. But lifestyle plays an important role in treating high blood pressure. If you can successfully control your blood pressure by following a healthy lifestyle, you may avoid the need for the medication, delay, or reduce the time to take it. Here are 10 lifestyle changes you can make to lower your blood pressure and always keep it low. 1. Lose more pounds and adjust your waistline. Blood pressure often rises as weight increases. Weight gain may also cause disrupted breathing while sleeping. This also increases blood pressure. Weight loss is one of the most effective lifestyle changes for controlling blood pressure. Losing weight even a little if you are overweight or obese can help lower your blood pressure. In general, you can lower your blood pressure by about 1 mm of mercury with every kilogram you lose. In addition to losing pounds, you should generally also control your waistline. Gaining too much weight around your waist may put you at increased risk of developing high blood pressure. In general, men are at risk if their waist measures greater than 40 inches, 102 centimeters. Women are at risk if their waist measures greater than 35 inches, 89 centimeters. These numbers differ across ethnic groups. Ask your doctor about the correct weight scale for your health. 2. Exercise regularly. Regular physical activity, such as 150 minutes a week, or about 30 minutes most days of the week, can reduce your blood pressure by 5 to 8 mm if you have high blood pressure. It is important that you continue because if you stop exercising, your blood pressure can rise again. If you have high blood pressure, exercise can help you avoid developing high blood pressure. If you already have high blood pressure, regular physical activity can lower your blood pressure to safe levels. Some examples of physical activity that you can try to lower your blood pressure include walking, jogging, cycling, swimming, or dancing. You can also try high-intensity interval training, which involves small intermittent bouts of intense activity followed by breaks of lighter activity. Strength training can also lower blood pressure. Aim to include strengthening training exercises at least twice a week. Talk to your doctor about developing an exercise program. 3. A diet is beneficial to your health. By eating a diet rich in whole grains, fruits, vegetables, and low-fat dairy products and reducing saturated fats and cholesterol, you can lower your blood pressure to as much as 11 mm if you have high blood pressure. This diet plan is known as the DASH diet. It is not easy to change your eating habits, but by following these tips, you can choose a healthy diet. Keep a food diary. When you write down what you eat for even just a week, it can reveal, in an astonishing degree, your true eating habits. Watch what you eat, how much, when and why you eat it. Consider boosting potassium levels. Potassium can reduce the effects of sodium on blood pressure. The best source of potassium is foods, such as fruits and vegetables, rather than supplements. Talk to your doctor about the most appropriate potassium level for you. Join the smart shoppers. Read food labels when you shop, and stick to your healthy eating plan when you eat out as well. 4. Reducing sodium in the diet. Losing a small amount of sodium in the diet may improve heart health and may reduce blood pressure by about 5 to 6 mm if a person has high blood pressure. The effect of sodium intake on blood pressure varies between groups of people. In general, limit sodium to 2,300 mg or less per day. However, low sodium intake, 1,500 mg or less per day, is ideal for most adults. To reduce sodium in the diet, please follow these tips. Read food labels. Choose low-sodium alternatives to commonly purchased foods and drinks if possible. Eat less processed foods. It is normal to have only a small amount of sodium in foods. Most of the sodium is added during processing. No salt added. 1 teaspoon of salt contains 2,300 milligrams of sodium. Use herbs or spices to add flavor to food. Take it gradually. If it is difficult to suddenly reduce the sodium in the diet, it can be reduced gradually. It will get used to the taste over time. 5. Reduce the amount of alcohol you drink. Alcohol can be both good and bad for your health. By drinking alcohol in moderation, 1 cup a day for women and 2 for men, you can lower your blood pressure by about 4 millimeters. 1 drink equals 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of 80 proof alcohol. But this protective effect is lost if you drink a lot of alcohol. Drinking more than moderate amounts of alcohol can actually raise your blood pressure in many ways. It can also reduce the effectiveness of blood pressure medications. 6. Quit smoking. Every cigarette you smoke raises your blood pressure for several minutes after it ends. Stopping smoking helps your blood pressure return to normal. Stopping smoking may reduce your risk of developing heart disease and improve your overall health. People who stop smoking may live longer than people who never stop smoking. 7. Refrain from consuming caffeine. The role caffeine plays in blood pressure remains undefined. It may raise blood pressure to 10 millimeters in people who rarely take it. But for people who drink coffee regularly, their blood pressure may or may not be affected little or no. Although the long-term effects of caffeine on blood pressure have not been established, it is possible for blood pressure to rise slightly. To find out if caffeine raises your blood pressure, check your pressure 30 minutes after you've had a caffeinated drink. If your blood pressure increases by from 5 millimeters to 10 millimeters, you may be vulnerable to the high blood pressure effects of caffeine intake. Talk to your doctor about the effect of caffeine on your blood pressure. 8. Reduces psychological pressure. Chronic stress contributes to high blood pressure. More research is needed to determine the effects of chronic stress on blood pressure. Occasional psychological stress may also contribute to high blood pressure if you react to the stress by eating unhealthy foods, drinking alcohol, or smoking. Take some time to think about the causes of your stress, such as work, family, finances, or illness. When you know the causes of stress, think about your ability to distress or distress. And if you can't keep all the stress out, you can at least deal with it in a healthy way. Try to change your expectations. For example, make a plan for your day and focus on your priorities. Avoid trying to do too much and learn to say no. Understand that there are some things that you cannot change or control, but you can focus on how you react to them. Focus on the things you can control and make plans to solve them. If you have a problem at work, try talking to your manager. If you are facing a conflict with your children or spouse, take steps to resolve the conflict. Avoid headache triggers. Try to avoid triggers when you can. For example, if rush hour traffic on your way to work is stressful, try to leave early in the morning, or take public transportation. Avoid stressful people if possible. Make time to relax and do activities you enjoy. Set aside time each day to sit quietly and breathe deeply. Make time for fun activities or hobbies on your schedule, such as walking, cooking, or volunteering. Feel grateful to others. Expressing gratitude to others can help relieve stress. 9. Monitor your blood pressure at home and go to your doctor regularly. Home monitoring can help you monitor your blood pressure, make sure that the lifestyle changes you make are effective, and alert you and your doctor about potential health complications. Blood pressure monitors are widely available without a prescription. Talk to your doctor about home monitoring before starting. Visiting your doctor regularly is also key to controlling your blood pressure. If your blood pressure is well controlled, talk to your doctor about the rate at which it should be checked. Your doctor may suggest checking it daily or less often. If you make any changes to your medication or other treatments, your doctor may suggest that you check your blood pressure starting 2 weeks after the treatment changes and 1 week before your next appointment. 10. Get support. Support from family and friends can help improve your health. They may encourage you to take care of yourself, drive you to the doctor's office, or join you in an exercise program to keep your blood pressure low. If you need support from people other than your family and friends, you should join a support group. This is likely to put you in contact with people who may be able to provide you with emotional or psychological support, and who may provide you with practical advice to control your condition.